Welcome to MedHeads, the weekly show that brings a biopsychosocial focus to issues of the day, along with special guests who will showcase their expertise and enthusiasm about their field of practice. Your host, Dr. Fergal Armstrong.
Hello everyone, my name is Dr. Fergal Armstrong and welcome to this episode of MedHeads. And today we have Aileen Toms, who is the Director of Primary Care and Innovation at a Regional Health Service. Hello Aileen, how are you?
Hi Fergal, how are you today?
I'm well. So I thought today we'd talk about our common mutual passion, which is health promotion stroke lifestyle medicine. You lead the health promotion service in your regional health service, and I passionately believe in lifestyle, and I'm pretty sure that there's a great similarity. So first of all, can you explain what is health promotion?
Well, really, I think the question for us all is really thinking about what is health and well-being. And if you ask a 20-year-old what does good health mean to them, they're going to likely say a great-looking body, clear skin, good teeth, beautiful hair. Maybe they'll talk about how they want to excel in their sport or go to the gym or something like that, which is very different to someone who lives with a chronic disease or disability, who may describe good health as being a day without pain or being able to walk to the garden for a little walk around the garden. So health for many people is very relative.
Yeah. I mean, I once heard that there was a definition of health as three things: not knowing who your GP was, an empty medicine cabinet, and a used pair of running shoes. So I suppose in that regard, we're describing health as the absence of disease or dis-ease. But I'm not sure that the absence of disease encompasses the domains of health that we are actually striving to achieve, both in both in lifestyle medicine and also in preventative health. What do you think?
Yeah, so, WHO describes health as a state of complete physical, mental and social well-being, not merely the absence of disease or infirmity. So it's been described as a condition or a state of well-being that's perhaps talking about being satisfied with life or being contented with the things that you have in your life. So health, in my view, is that it's a resource for living. It's not the purpose of our lives.
So it's a resource for living, but it isn't the purpose. I like that, because one of the pillars of what I regard as lifestyle medicine is actually having a purpose in life. So I suppose being healthy is a resource, not necessarily the purpose. How do you promote that in health promotion? What kind of activities do you promote to achieve that purpose in life?
Yeah, we certainly look at, good health and the different domains of whether it is around feeling positive in your own mindset, being able to cope with life stressors, an ability to work productively, realising, people's own potential and being able to contribute to their own family and community life. So we support a lot of different programs that also look at the wider forces and systems that shape the conditions of daily living. So that's what's known as the social determinants of health.
That's a very interesting segue into what are the determinants of ill health and what are the determinants of disease. I mean, I suppose it's important to understand the difference between a proximal and a distal cause, and health promotion lies in that space, doesn't it? What is that difference? How would you explain it?
Yeah, so there are things that we can't change around in our own makeup. So our natural biological variation is the things like our sex, our age, our genetic makeup. But the conditions in which people are born, learn, work, live, age, the wider forces, that's what we describe as those social determinants. So the distribution of money, power, wealth, and also thinking about our environments, like climate change is something that we also have to consider now. So thinking about those ecological determinants of health. And some people have more of those resources. So the groups that we might work with in Cardiniashire that experience that social and health inequity include people that might come from a different background, a called background, or they might be, they might describe themselves in the LGBTIQ community, or Aboriginal people, or people with a disability. So, it's these sorts of...
Generally, those who are marginalised.
Yeah, that's right, that are marginalised, and they experience, poorer access to services, to jobs. They might have less ability to navigate the health system because their health literacy is poorer. So these are the kind of things that, that health promotion addresses.
Yeah. I often think of the determinants of health in terms of whether or not it's a distal or a proximal determinant. I often think of a plane crash. So what's the absolute proximal determinant of a plane crash is the fact that there's not enough lift coming from the wings, and therefore gravity is causing the plane to fall out of the sky. Whereas the distal determinant of that situation could be an engine failure because the car mechanic didn't do the repairs right, because he had a bad night's sleep, because he had a fight with his wife. So actually the determinant of that accident, it all started out with a fight from the wife. So it's important to understand. I suppose it's important to ask the question why. So, if we take an example like smoking, so we know that people from lower socioeconomic backgrounds smoke. Well, the first question is why? Why is it that people need? Is it something to do with health literacy? And if there is an issue with health literacy, why is there a health issue with health literacy? Is it because that they don't speak English? Well, why don't they speak English? Is it because they're an immigrant that hasn't been supported? Well, why haven't they been supported when they've come into this country? Why haven't they been given the equitable access to services? So therefore, you tend to kind of, I suppose you expand the envelope of responsibility when you start analysing the distal determinants of health.
Because we start to look at...
come into health promotion.
Yeah, that's right. So we start to look at those environments and what are the causes of the causes. And
the causes of the causes, yes.
Yeah, so think, and definitely the old saying about an ounce of prevention is better than a pound of cure. So I think that, health services are not necessarily where we go when we have a problem with our, they're where we go when we have a problem with our health, isn't it? But we don't go necessarily there when we're well.
Yeah. Or when we don't realize that we're unwell, or when I suppose when we don't realize that we have risk factors for illness.
When we don't realize we have risk factors for disease, yes. And I think that, many medical practitioners do encourage and practice that primary prevention, as you've said, that lifestyle medicine, and early intervention to get on top of these modifiable risk factors, such as tobacco use and harmful alcohol consumption, or physical inactivity, high blood pressure, obesity.
Yeah. You're absolutely right. Those are risk factors that need to be addressed. And I suppose I think about the pillars of lifestyle medicine when I'm thinking about these risk factors. I think about what I call the 3 F's and the 3 S's. So I would say the feet, the fork, the fingers, sleep, stress management, socialization. So the feet, exercise. We need to promote the benefits of exercise. Everybody needs to be active. The fork, diet. We need to pay attention to what we're eating, and we need to eat more of the more nutritious foods and less of the processed foods in our diet. Then the fingers, so we need to stop smoking, we need to moderate our alcohol, and we need to abstain from other illicit drugs. Sleep, we all need 7 to 9 hours sleep a night, good quality sleep. Stress management, we know that stress causes disease. It causes heart disease, it causes diabetes, it causes obesity, it causes death. So we need to reduce the stress in our lives. And then socialization, we all need good, meaningful relationships that allow us and facilitate the engagement with purposeful activities. John Donne, the poet, said, "No man is an island in and of himself." Well, that was true back then. It's even more so now true, because we're now living in the time of COVID, where our ability to actually form meaningful relationships is very, very curtailed. I mean, how does that fit in with your view of health promotion?
Absolutely, Fergal. I agree that it's very much a healthy lifestyle. Not only affects your physical body, but it impacts your attitude to life, your mental state, your emotional state, your mood, your spiritual well-being.
Yeah.
So if you're doing something that makes you feel better mentally, whether it's, regular exercise or meeting with a friend, going to the park or being in a natural setting that just uplifts your spirits, then you will be more likely to spend time in that environment. You'll be more likely to exercise. Things like eating junk food, but if your motivations maybe that you need to save money, then maybe that's what you would actually target. Because, eating junk food, sugary drinks, alcohol, they're all expensive habits. So it's maybe tapping into something that seems quite tangent to what the risk factor that you see as a medical or a health promotion practitioner. So they're the kind of things that, being able to take control of your own life does in some ways help to empower you. But I guess it's, it sounds easy, but, there's just so much information for people around what to eat, how to exercise, how to live and achieve that healthy life. But it's there's lots of obstacles in people's way.
So, Aileen, what do you think the obstacles are, as you've mentioned, to accessing these kind of health interventions?
I think that there are a lot of obstacles for people, and that it's really thinking about chunking things down, taking some of your old habits.
What do you mean by that?
So make small steps. Don't think that you're going to change your whole life in one fell swoop. Chunk it down into something that's manageable for you. And if it is about swapping out a unhealthy meal once a day, maybe you do tend to stop off and pick up some junk food. Swapping that out by making a healthy sandwich for yourself instead of the unhealthy food. So start with just some small steps that you can do. If you need to think about perhaps going for a walk, make it achievable for the first little while. Set yourself small goals, to the letterbox, up the hill, rather than trying to think that you're going to start on the marathon.
So what I'm hearing from you, Aileen, is actually you need to make the tasks achievable. The goals need to be smart. They need to be specific and achievable goals that need to be applied over time. And to what extent do you think that personal accountability falls into this idea of getting people across the finish line in terms of accepting this message?
Yeah, so I think it's a mixture. I think the environments definitely need to be supportive, and that's where governments and different levels of things, because a lot of the changes that people need to make are very difficult if they live in an environment that's not conducive to those things. So certainly governments can certainly do a lot of things in around creating walking paths, safe tracks, choosing them, but I think certainly the people themselves have to want to make the change as well, and want to stay, so they can use tactics to stay motivated, or connecting with other people. Getting a buddy to walk with really helps to connect you in, and that will really help. And it's with everything. If you have another person that can help to keep you on track, whether it's a partner, someone to discuss or cook with your meals, these are the things that can help. And also maybe giving yourself a little reward of something. It doesn't have to be food if you're trying to lose weight. It can be a reward of another kind to keep you motivated and on track.
So part of health promotion, and indeed part of lifestyle medicine, is actually understanding and the change management process, and also the development of motivational strategies to facilitate that change management, as you've discussed. So, Aileen, we've heard a lot about, what is health promotion, what needs to happen in health promotion, what are the obstacles, what are the barriers, what you can do to actually make those first steps. What's your final message of hope for today's episode? So,
Fearnal, I think my tips are love yourself, value yourself, move your body, watch your portions, and stay connected to friends and family.
I couldn't have put it better myself. Aileen, thanks so much for your time and expertise tonight. I really look forward to chatting with you again very soon in greater detail on these topics.
Thank you.
For tonight, thank you very much.
It's been a pleasure.
My name's Dr. Fergal Armstrong. Thanks for watching. We'll see you next time.